Welcome back to Daytime. Well, all those parents watching, lately we've just, in the last few weeks, got all the progress reports back from school. And some of them have this new identity of self-regulation and behavior and things like that. Well, I have two experts in studio. They're going to teach us a few things about children and movement and the importance. Welcome Heather Hodgins-Chan and Liane Norman, and you are the owners of Pediatric Physio and Occupational Therapy. Welcome to the show.
Great, thanks for having us.
Thank you, and I know it's a big mouthful of what I just introduced, but both of you come from really, really interesting therapies. Can you tell us a bit about your background?
Well, I'm an occupational therapist, and many people don't know what occupational therapists do, but we are a regulated health profession, and we help people with all of the things that they need to do on their daily life. So anything that would occupy their day. So that's where the name came from.
Oh, now I'm going to remember it for sure. Thank you. And then the physiotherapy?
So as a physiotherapist working with kids, so we offer one-on-one hands-on therapy for kids from babies to from 0 months to 18 years old. And so we work on the physical body. So kids with difficulty with posture or low tone or movement in general, and of course pain. We treat all of those conditions.
Absolutely.
We work with those kids.
Now we were just talking earlier, there seems to be a bit of a rise of sort of anxiety or the need for children to go through some sort of like physical being and occupying their time and get some movement in. So why do you think that rise is happening?
Well, we're noticing that a lot of children are not so active as they used to be after school. And even during school, they're supposed to be sitting for quite a bit of the day. And so that really challenges a child in terms of regulating themselves and you know, keeping their nervous system in check.
Yes.
A lot of children get very stressed out if they have to sit in one position for very long.
And so this does happen at school, but then when they come to you, you really teach them sort of ways in which to keep their body moving, right? So you've got all of these on the table. So can you bring us through some ideas of what you can do to help a child through this sort of, would you say it's an anxious state or a state of anxiety?
Well, a lot of children with anxiety have difficulty processing sensory information. That is the process by which sensory information is registered in the brain, so that we know what sort of information we can filter out and what's important to our day. So for example, some children may not be able to filter out the noise in a classroom, or they might find that the lights are too bright. And so what it does is it affects their attention and their ability to self-regulate, and they're always moving all over the place.
Yeah, and do you find that kids are very open to talk about what they are feeling and that they do get this anxiety when there's too much movement, or do you feel like you have to pull it out of them a little bit?
It really depends on the child.
Yeah, okay, I could see some experiences in there.
Yes.
This would offer the child a little bit of quietness in the classroom? Or?
Yes, so these are noise-blocking sensory headphones that we often recommend to children to wear in the classroom if they have difficulty processing you know, what the teacher is saying if there's a lot of noise around. And we also have brought some cushions with us. These are kind of known as wiggle cushions. They help children move around so they get that movement while they're sitting.
But they can also stand on it for balance.
And
you know, so
yeah, and I have to, maybe I'm bragging, but our school must have been in touch with you, because I feel like all of this is available to the kids, and they're really appreciated because it allows them, all of us need to move. That's probably what you're finding. And you have some interesting ideas, like what made you get into this evolution of all of this working with kids with anxiety?
Well, first of all, by working side by side with occupational therapists, with Heather, I discovered there's a big role for physiotherapists to play in teaching parents and kids how to incorporate more movement in their day, in the school and at home. So I will often recommend like have balance discs in the home and in the classroom, Bosu balls, so kids can, they do their homework, after 15-20 minutes they can get up, balance on their balance disc or on their Bosu ball, or even just hop a little bit and then get back to work, and then they can focus again. You know what, that's such a smart thing that you say that, because even when you see your kids when they are doing homework, there is only a limited amount of time that they can stay focused. And my daughter has, I guess she's self-regulated. She's like, I'm just going to go clean my room for 10 minutes, and then I come back, and then she finishes. So that is someone who's able to make those decisions. But you guys are experts, so you're actually inviting people who are unable to make those decisions to come and see you.
Absolutely.
Yeah,
and
that's
some
good.
kids can't express that they need to move. They'll just move all the time or fidget, or you know, we want them to sit down at supper table and they just have this need to get up and they can't sit, but they can't tell the parents that, hey, I need to move. It's just that we give them the movement before they actually
communicate it. Yeah, absolutely. Okay, so what other things that I like this water here. That doesn't look safe. Here, I'll bring you even around a little bit more this way. There you go. Yeah. So what have you got?
So what we have here is just a container of water. We have some airline tubing, and this is a common exercise that we show children at the clinic. Absolutely. Yeah, for sure. And so we know that breathing is very important for helping to regulate the nervous system. So it's kind of similar to yoga in that, you know, you breathe in, you breathe out, and what happens whenever she's exhaling is that a parasympathetic nervous system response is happening. So we know that it helps to relax the nervous system, and if we're relaxed, we're able to learn better.
And you know what, just seeing this, I know we don't have a ton of time, I feel like a lot of kids who get that anxious, they're taking more breaths in than breathing out, and this is brilliant and super fun.
And we put a drop of dish soap sometimes, and so we get a mountain of bubbles, and it's even better. The kids want to blow out, they want to exhale, and that exhalation does trigger that.
You know what, we've got your website on the bottom. People have to check you out for more advice. Thank you so much for joining our show, and everyone else, get the bubbles out because that is super fun. Don't go away, we'll be right back with a lot more daytime.